Good afternoon, everyone. My name is Dan Svensson. I'm a graduate student at the University of Southern Maine School of Nursing. I am completing my master's degree in the Family Nurse Practitioner program. I'm here today to present to you my clinical project, which I did on the inhaled isopropyl alcohol in the treatment of nausea. So why this topic? So I was doing some clinical work with a local geriatrics group, and during one of the case conferences, we had a provider from palliative medicine doing a presentation. And one of the topics that was presented was the use of alcohol swabs in the treatment of nausea. Surprisingly, none of the providers in the room had ever heard of using this and weren't sure of how effective it was. So that sparked my interest in the topic and for me to explore this idea a little further. When looking at the research, there's reportedly just below about 5 million ER visits annually in this country related to nausea. So if we could come up with a relatively easy, inexpensive treatment for this without the use of medications, that would probably be best for all of our patients. So what exactly did I look at? So the study, or my question for research purposes was, in patients with nausea, how does inhaled isopropyl alcohol compared to the usual care affect decreased nausea? Well, when researching this in the various databases, I was surprised to find that research was pretty limited. Initially, I had tried to search the databases within a 5-year period, did not elicit very many studies. So I expanded it to 10 years, which I found a few more studies. And then they were all appraising a rapid appraisal tool. So basically what I ended up having for research was 4 studies. There was 2 blinded randomized controlled trials. These were all conducted, both of these were conducted in the emergency room. They were all adult patients presenting with nausea. And then the reported cause of nausea can include gastroenteritis or food poisoning, UTIs or URIs, headaches, or gallbladder and appendicitis and kidney stone. There was another randomized control study that was done in a postoperative setting, and it was an all-female subject pool. And then finally, there was one meta-analysis that was just published last year. Again, this was in a postoperative setting, but did include adults and children, and also examined other interventions involving aromatherapy in the treatment of nausea. So basically, any data that was related to isopropyl alcohol was extracted from this, and none of the other interventions were explored during this study. So what did the results show? Well, it showed clinical and statistical significance on the effect of nausea rating. So both the April and Beetle studies, which are the 2 that were completed in the emergency room, did show that it had a good effect on improving nausea severity scores. So in the April study, there was an effect size of 23 using a VAS score, which is a visual acuity scale from 0 to 100. And then Beetle used a verbal numeric rating scale, which is 0 to 10, and they had an effect size of 3, both of which were clinically significant in their respective studies. There also was the research suggested that there was faster reduction in nausea. Cotton et al. Reported that the use of inhaled isopropyl alcohol was just under 19 minutes faster to reducing the nausea severity by 50% after the first treatment, and then 11 minutes faster for the second treatment. And then in the meta-analysis, in the 3 pooled studies, there was did show that it was significantly faster effect on nausea. And then finally, they also explored the need for rescue antiemetics with the use of inhaled isopropyl alcohol. And overall, throughout all of the studies, they showed that there was a significantly, there was less likely need for any rescue antiemetics. The biggest one being the study by April back in 2018 showed a 20% less likelihood of needing rescue antiemetics when inhaled isopropyl alcohol was used. So, I mean, that's pretty significant, going from 45% down to 25% with the use of inhaled isopropyl alcohol. Cost is also a factor when considering an intervention. What's one of the major common interventions we used for nausea? Zofran. So ondansetron is one we typically prescribe to patients with nausea. So if we give a prescription for 10 ODT tabs, a cash price at most pharmacies are anywhere between $30 and $70. Even with a discount coupon, it brings it down to about $10 or $15 for 10 tabs. And typically, this is what an insurance copay would be as well. Comparing that to an alcohol swab, a box of 200 is roughly $3.50, by far cheaper than what it costs for a prescription of Zofran. The biggest thing is that these swabs are readily available in most clinical settings and even could be purchased easily by a patient at any pharmacy. When considering the research, we got to look at the evidence. The biggest thing is the evidence is consistent amongst all the studies that was included in this project. One thing that does have to be taken into consideration is the characteristics of the population in each of the studies. The big thing is the two randomized control studies in the ER had populations similar to what we would see in a clinical setting. However, they did not include children. The other two studies by Cotton and Hines, they were mostly female and did lack similarities to a population we would see in a clinical setting. However, this may weaken the evidence a little bit, but it should still be considered. Other big things is there was no adverse effects reported in any of the studies with the use of inhaled isopropyl alcohol. So the risk is pretty minimal to consider using this intervention. The other big one is the cost. Again, it's very inexpensive and readily available in most settings. If we can use this as an intervention, it can likely lead to a decreased need of prescribing medications for our patients. So what can we do in the future? Well, first we could start with implementing a pilot program. This would involve doing a training for any staff about this intervention, creating a protocol or standing order for nursing and/or staff to implement using inhaled isopropyl alcohol for any patients that complain of nausea. The big take-home points should be providers should still be notified anytime the intervention is initiated, and there should be a feedback form whenever this intervention is used to record the effect. So there should be a pre- and post-intervention nausea rating scale so that we can have an idea of how effective this was on the patient's nausea. Something like this, we could start small and expand out as we have improved outcomes. So we could start with, one particular provider group or one particular unit within a facility and then expand it out as we see fit. So how do you use it? Well, it's pretty simple. You just tear open the alcohol prep pad packaging. You don't have to remove the pad. You could leave it right in. You just want to ensure that the torn edge is open, and basically you hold it about 1 inch below your nose, and you instruct the patient to take some slow, deep breaths in. You don't want it any longer than 60 seconds, and you can do it 3 times on the same prep pad. If the nausea continues, you can tell the patient that this can be repeated every 15 minutes as needed for any nausea. And again, it's important that if our staff is implementing this, we should have a feedback form so we know what the severity of the nausea was pre and post intervention. That is a brief overview of the findings of this project. If you do have any questions, you can feel free to email me. My email is at the bottom of this slide here. I'll be happy to respond to any questions that you have. Also, your feedback is appreciated. There'll be an online form for you to complete after listening to this video and provide honest feedback of what we could do to improve or better this presentation. These are the references that were used as part of this project. And finally, this is the presentation poster I created to present this information about this project. Again, I appreciate your time in listening to the outcome of my project. And again, any feedback you have is greatly appreciated. Thanks, and I hope you guys have a great day.